Hi, my name is Aditi Rao, and I'm a third-year medical student at the University of Michigan Medical School. My research question was looking to see if a simulated paging curriculum was effective in improving interprofessional communication skills for fourth-year medical students pursuing pediatrics at the University of Michigan Medical School. The reason we were interested in this research question was because there is a plethora of data that currently exists that cites that poor interprofessional communication skills leads to adverse patient outcomes, particularly decreased patient safety and decreased patient quality of care. Furthermore, residency program directors cite that strong interprofessional communication skills are very important and necessary for interns to have day one. However, interprofessional communication skills are usually not formally taught or even assessed at the undergraduate medical education level. Benefits of simulated paging curriculums to improve interprofessional communication skills have been demonstrated for students pursuing surgery and internal medicine. However, there's very little data for how this educational intervention can be effective for students pursuing pediatrics. In our study, fourth-year medical students at the University of Michigan Medical School that were enrolled in the residency preparatory course for pediatrics specifically in both 2019 and 2020 responded to scripted pages from standardized registered nurses. Over the course of their 4-week residency preparatory course, they received 4 pages focused on 4 cases. After they received the page, the standardized registered nurses scored the students on giving them a global communication score on a scale of 1 to 10, with 1 being highly ineffective and 10 being highly effective. Overall, we saw that in both the 2019 and 2020 cohorts, the global communication skills increased from case 1 to case 4 over the course of the residency preparatory course. This was seen, as I said, in both cohorts. So what does this tell us? This tells us that a simulated paging curriculum is very effective in improving interprofessional communication for senior medical students pursuing pediatrics. The fact that similar results were found across both the 2019 and 2020 cohort, and the fact that the case orders differed for both the cohorts contribute to the validity of our finding as an effective educational intervention. We also feel that by implementing this type of interprofessional communication training at the undergraduate medical education level, we're helping prepare our learners for entry-level ACGME milestones in pediatrics. Currently, 2 of the milestones listed are working in interprofessional teams and incorporating formative feedback, both of which are used in our educational intervention. We acknowledge the limitations of our study, that it is at a single institution with a small number of participants. We really feel that administering this type of educational intervention right before students enter residencies is a very helpful tool to help them gain more skills in effective interprofessional communication. And we actually hope in a future study to evaluate how well this type of information learning in interprofessional communication transfers over into residency. Overall, we found that the simulated paging curriculum was effective in improving interprofessional communication skills for senior medical students pursuing pediatrics. Thank you.